was diagnosed with MS 20 years ago in September. So I've had a whole lot of issues that Matt has helped me with, but I'll try to sum it up. I started using the mat in, I think it was, we decided, I think 2022. I had a loaner mat that was Tina's. The first thing that I noticed around that time, I also was having a lot of bladder issues. I see a lot of specialists up at UW, and actually had gone in for a consultation and done the initial testing to get a pump put in because I wasn't able to empty my bladder well enough, and I kept getting UTIs. Around the same time, I started using the mat, and that was the first thing that cleared up. And now the thought of having an internal pump put in is baffling. I also deal with severe spasticity. I also have kyphosis, so I have other back issues going on as well. But my spasticity would pull so hard forward that it was pretty much impossible for me at physical therapy to be able to stand flat against the wall, shoulders against the wall, anything like that. And within the first couple weeks of using the mat, my shoulders actually could relax back onto the mat. I was so excited. I called my husband in and said, look, look, look. And same with my feet. My feet have spasticity in the tendons, and they curl in. And when I started using the mat, I was able to put my feet flat like this, which was nearly impossible. So because of the mat, I decreased my muscle relaxers substantially. I was to the point of taking baclofen. I don't know if anyone's familiar with that, but it's a muscle relaxer. I was taking so much that if I were to take any more, I would have to get an internal pump. On top of that, I was taking diazepam and getting a little bit nervous about how much I was relying on that, as I know it can be addictive. Those things are, like I said, I still take baclofen, but probably a third of the amount of it, and I rarely take Valium now, where I was afraid that I was going to have a problem at that point. The mat is better than, helps me relax better than Valium or any muscle relaxer. I recently, in February, had a very severe muscle spasm. I don't know if you want to call it a seizure. It was, yeah, part of my spasticity. I had a severe spasm. Everything was pulling inwards. I could barely breathe. My chest muscles were spastic. I actually ended up tearing a muscle in my leg from the spasm. But during that time, my husband helped me and got me some water and helped me on my mat. And within 10 minutes, I was able to breathe. I was able to relax. I wasn't panicking. I wasn't hyperventilating. So yes, that was huge. I cannot even explain. It was like a life rope that was tossed out. All of a sudden, we'd gone through these spasms before and almost called an ambulance because I couldn't get off the floor, and then the anxiety would kick in and I would be totally hyperventilating and seizing up, and the mat prevented that. Along with that, I guess I was able to drop all of my psychiatric meds. I use the mat. I have my own now. I bought one in 2023. It's the hybrid. I use it at least twice a day, normally 3 times a day. I'm pretty religious on it because it helps me so incredibly much. Since I've been using it religiously, I have dropped all psych meds. I was on a lot of heavy duty stuff. And I guess the last thing to add, because I could go on forever, I do have back issues. I have kyphosis, which is the humpback. Upon researching and looking into that at UW, they found that I had a compression fracture on T6. And their option to me was, well, I don't think you need surgery yet, but we'll send you to pain management. And as a lot of people know, have probably known someone that can be very dangerous to be relying on painkillers and narcotics. So I opted out of that, and I listened to Tina, who said, make sure you use the applicators too, not just the mat, because I was so devoted to just the mat. So I would use the mat in the morning, I would use the mat in the afternoon, and then at night I would use the mat, but I would also then, when I got off the mat, use the pad on my T-spine, where I'd sit and watch TV or anything. And now, once again, it's not fathomable for me to think about going to a pain management doctor and relying on Oxy or something for the foreseeable future. So I have nothing but amazing things to say about the mat, and yeah, thank you for listening.